Welcome to this brief tutorial on radiology appropriate use criteria related to advanced radiology imaging such as CAT scan, MRI, nuclear medicine. This tutorial is focused on if a proxy delegate was to look up the required Medicare decision support guideline for a physician, which until an upgrade must be done at the website rather than within the TMH Allscripts system. Step one is to go to this website as listed here, HTTPS, it's a secure HTTP, and then qcdsm.nationaldecisionsupport.com. You can see the web address in that little tooltip as well. Once you get to this home page, it's this area on the right, open access registration. Access the registration page. You fill this out, creating an account with your email, a password, name, your role within the organization. And then you submit that, and you'll have to have access to that email to be able to confirm the account and activate it. When you do the registration, it is recommended that you use the Chrome browser. There seemed to be a issue with using Internet Explorer during the registration process, and so I'm also going to use the Chrome browser for the demonstration as well. So I'm already registered. I'm going to click to log in. The CareSelect user interface is pretty straightforward. This decision support system takes a couple of pieces of information. It takes the patient age, takes their sex, it takes the imaging study that you're considering ordering, and it takes the diagnosis. And so using those pieces of information, it gives you an appropriateness score and shows you alternative appropriateness scores for other studies for the indication that you've chosen. I'm going to go through a few demonstrations here to show you what kind of information you get and what you're going to do with the information. So here's an example of a 55-year-old female for which the doctor is considering ordering a CT abdomen with and without contrast for the indication of some acute abdominal pain, non-localized. Interestingly, the engine gives no appropriateness score for that specific study, but it is higher cost and higher relative radiation level. It does, however, give alternative studies, including giving guidance that a CT abdomen pelvis with contrast would be in its high level of appropriateness scoring range. Then you have decreasing levels of appropriateness as you go down this list. So yes, even though there's no appropriateness score for this test, you could choose to select this service. But perhaps this also guides you saying, I do also want the pelvis to be included in my imaging. So I'm going to select the CT abdomen pelvis with contrast. When I select that service, I get a decision support number. I get a HCPCS code that maps to this particular company, the National Decision Support Company that this website belongs to. There are multiple vendors. This is one. And I get a modifier that basically reports the outcome of the consultation with the engine. So the decision support number, the HCPCS G code, and the modifier, those are the three important items that the radiology performer of the service will need to submit to Medicare in order to cover this kind of study come January 2021. So if using the website, you have the option to copy this information to the clipboard and go into Allscripts and paste that into the order so that it will print on the requisition. Here's an example of considering doing a calcium score on a 65-year-old female with chest pain and a normal EKG. There's no specific score and no alternatives are given for this specific combination. You can still do the same thing, select the service, get the information to put into the Allscripts order requisition, and that meets the requirement. Here's an example of 72-year-old male consideration of a cardiac MRI for an indication of congenital heart disease. So the cardiac MRI is given a number 8 appropriateness score. Doing the test with and without contrast, even they consider more appropriate, and also could just choose to do a transthoracic echocardiogram with much less cost involved. Chest x-ray with least cost but with a relative radiation level given. So while a delegate can certainly perform this function, there may very well be a need for some feedback from the provider based on the alternative services that are offered versus just always selecting what the doctor has ordered and within a particular pattern of care that can be done. Ultimately, if you have low appropriateness scores, Medicare will start tracking your kind of appropriateness score average for the tests that you order, the quantity and types of tests that you order, and they will come up with a tiered system of potential penalties, or the main penalty would be prior authorization, a prior authorization process if your appropriateness scores fall below a certain level in the future. So the main items here are to sign up for an account, log in, place the demographics, the service needing to be ordered, and the indication for the service. Look at the appropriateness score. If the provider needs or wants to make a change, they can make a change. If not, or once the service is chosen, select the service, get the details of the decision support number and the appropriate HCPCS code and modifier. You can use the copy to clipboard function to move that information over to the Allscripts ordering process so that that information is available for the external radiology company that's going to perform the service, or for the internal radiology department that is going to need this information to submit to Medicare beginning in testing for 2020 and definitely required January 2021.